I'm going to be honest with you. Recovery after a rotator cuff surgery is a tough road. You're looking at a recovery that's just not only lengthy, but often quite painful and takes some serious motivation to be done correctly. And there are a number of common mistakes that people make that can negatively impact their outcomes. So to help you make the best of it, I'll be breaking down some pearls and pitfalls when it comes to rehab after a rotator cuff repair. Hey everybody, welcome back for another episode of Physio Show. In my experience, many patients are surprised by the challenges they come across when recovering from a rotator cuff repair. I believe this is a combination of not expecting the amount of discomfort they will have and how much time and effort is required of them throughout recovery. This is all due to expectations not being clearly laid out prior to surgery. So hopefully this video can help all of you who are thinking about having surgery or about to undergo the procedure. The first pitfall I will discuss is not being prepared to manage pain. Rotator cuff surgeries are very uncomfortable. While not all repairs are the same, with some being more invasive than others, you can pretty much guarantee pain will be part of the recovery process. This is not only due to the trauma of the surgery itself, but also due to the amount of time your shoulder will be out of commission. A combination of immobilization, muscle spasms, and scar tissue can result in the shoulder being stiff and make it more painful to move. My pearl for pain is to prepare yourself mentally for what's to come. You will be able to manage better if you know what to expect and just accept the fact that you're going to have some pain. Besides the mental preparation, there are things you can do to better manage the symptoms. Make sure that you listen closely to your doctor regarding pain medication and follow those recommendations closely. Also, make sure you're icing frequently and utilize distractors throughout the day. Anything that takes your mind off the pain is helpful. After all, your brain can only focus on so much at a time. A crossword puzzle or even a good book can be just what you need to take the edge off for a time. The second pitfall that patients fall into is the development of postoperative stiffness. As we highlighted, the early phases of recovery, there will be pain and moving the shoulder is going to suck. That's why pain management is so key. But you need to move that shoulder early and often. Gently moving your arm frequently, multiple times a day through various ranges of motion, as instructed by your physical therapist, is key to prevent that shoulder from stiffening up, because you don't want to be dealing with a stiff shoulder. For you Harry Potter fans out there, the word stiffness is like the word Voldemort of the orthopedic world. It's a word no one wants to hear. My pearl to prevent postoperative stiffness is to stay consistent with your flexibility exercises. Schedule out blocks of time during your day to do your exercises. Now you don't need to crank on your arm. Early and gentle motion is all that you need to regain motion. But this requires consistency. Slowly but surely, more and more mobility will be gained. This mobility will result in less pain, less risk of stiffness, and better outcomes as you will be able to use your arm more effectively and more functionally. The third pitfall is not focusing enough attention to the positioning and control of the shoulder blade early after surgery. Now you'll be restricted from using your arm in an active manner for about 6 to 8 weeks, depending on the type of repair, and most of the focus will be on preventing stiffness. It isn't until the restrictions are lifted that people often now start to focus on what's going on at the shoulder blade. This leads to delays in rehab, as time has to be spent getting the mobility and control of the shoulder blade up to speed before they can advance their exercises. My pearl for this issue is to focus on the shoulder blade early. This will set you up well for when you start moving it actively. Think of the shoulder blade as the cornerstone upon which your movement is built. Its role is fundamental to stability. Another way to think of it is attempting to run on sand versus a track. The power and stability you experience on the track far exceeds what you encounter on the shifting sand. Your shoulder blade functions as the stable surface from which shoulder power and control is generated. My last pitfall for those undergoing rotator cuff repair is prematurely abandoning the strength program too early after surgery, once pain is reduced and sufficient mobility has been restored. While this may be good enough for some people, it can limit those needing to go back to work or sport activities that require heavier lifting or high forces through the arms, because restoring muscle strength takes months and months of consistent strengthening to improve. I'm talking over a year following a progressive strength program. This means that even after physical therapy, continuing with the home strength program is essential. My pearl is to make sure you set yourself up for success in the later phases of recovery. I suggest getting a gym membership so you have access to the proper weights and equipment to continue improving strength. Although good in the earlier phases, TheraBand will only get you so far. If you can't go to a gym, I suggest purchasing some weights for home so you can maximize the results of the surgery. Make sure to speak to your therapist about what exercises and weights would be best for you. Now, because injections are so common for rotator cuff injuries, you may also have some questions about this treatment as well. Or maybe you're wondering what a good versus a bad physical therapist looks like. Here are 2 videos on these very topics. And if you have any questions or insights, please feel free to share the comments below. If you found this video helpful, give it a like so it can spread and help more people.